Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
My next guest is Lisa Lane, whose title is Patient Care Advisor for JN Nursing Registry, Inc. Now, you know, we talk to a lot of people who should have home health care, and they don't, because they say, I don't need any help. I'm independent. And I always say, well, if you had help, you'd be more independent. So, Lisa, we're going Lisa, we're going to talk about JN Nursing Registry and what you think people should be thinking about having home health. Is it so bad?
No, it's fantastic to have it. When you're at home, if you've had a procedure done, or if it's for a family member or a senior, and, it's difficult to get up, if you've had a procedure, you're older, to carry a laundry basket or go run errands, get your prescriptions filled and those types of things. So, it's just so wonderful to have somebody there to help you do those things. And, you can do it temporary or you can do it long term.
One problem that happens with a lot of older adults, they think they have a daughter or son's going to help them, right?
Right.
Yeah. Now, that even if they're here in South Florida, wrong. But imagine all the people who are up in Boston and Chicago. They come down for a weekend. Okay, now they go away.
Right. I mean, you have to remember that we all have our own lives. We're all busy. We work. We have families. We have things to do. So as much as I think their family wants to be there and do that, sometimes it's just difficult to do that. We're all busy. And, that's where we can step in and, we can take over and we can report to them and let them know everything that's going on. So, that they do feel that they're still involved and that they're not going to feel guilty for going on with their lives.
So if someone calls you, so they call JN Nursing Registry, and I'll give that number, 561-330-6530. Remember, this is Pencil Talk Radio, so write the number down. That's what the pencil's for. Just tell me, what do you say when someone calls? What do they even ask when they first call?
Certain people will call. A lot of people don't even know about the service. So sometimes we, are referred from a doctor if they're in a facility or a hospital. And we'll talk to the family, see if they do even have like a policy that will cover those services, because sometimes they do. And then we just kind of go over what we can provide for them. The best thing for us to do is to send out someone to go out and do an assessment, which is typically done by a registered nurse, that will go out and see what specific needs they need, that we can cover for them. So I think the best thing for us to do is to be able to go out there, meet with the family, meet with the person that needs the services, and then we can kind of determine together what would be best.
And I have heard many times that the first time someone comes in is a little bit tough because they don't want anybody.
Right.
But that if you have really good people who you're sending, they not only become someone that helps them, they become a friend.
Right. They become part of the family. Sometimes it might take a couple times to get that right personality. We're really good at it. We've all been doing it for a very long time. So we're pretty good at matching personalities and depending on what care they need, that person has experience with that. But yeah, I've seen, people are home health aides and CNAs that have been with families for years and they become part of the family and the family comes totally dependent upon them. So it's a wonderful thing because it is somebody that does become part of the family. And as many tries as it takes, we'll get it right and make sure they have that perfect match.
One thing, I just, kind of off the subject, but it's not. A lot of older people, it's a good example. We lost our dog recently. We had to put it to sleep, and I was given or asked if I would take this new dog. And this dog's 8 years old, and I felt terrible about why I had an opportunity to get the dog because the man, the owner, was an elderly gentleman.
Oh.
He had a stroke, and he went to a rehab center and then to a nursing home. Now, here it is. The dog misses him. He misses the dog. All he had to do was hire a healthcare company.
Right.
Of course, I didn't know the family. They never asked me.
Right.
That's happening all the time. A lot of people have pets, and if something happens, they lose the pet. And that man, I'll bet he is miserable. So what they should have done is called JR Nursing.
Right.
And they should JN Nursing. They should have called JN Nursing Registry, and they could have arranged to have him back at his home. He would have progressed better because he would have had his dog.
Yeah, absolutely. And just to have all your own personal items and be in your home. I know if I have to go to the hospital, I go home. I feel so much more comfortable. Like I just want to go home, and you want to go home and you have somebody there that's going to help you so you can be back at home where you're comfortable. And I feel I've seen seniors that they live longer, they progress just being in their atmosphere back at home with their pets or neighbors or, their atmosphere that they're used to.
So if you had someone like that, would you walk their dog?
Sure.
Okay.
We have,
I assume that you would be doing that without even asking you.
Yeah, and we ask them, if they have pets or cats or dogs, so that's something that, we match with the caregiver. There's somebody that isn't afraid of dogs or loves dogs, like, sure, I'll take the dog out, so yeah.
Okay, well, I just want everyone to know that I am talking to Lisa Lane. Lisa Lane, that sounds like a movie star somehow.
Like Lois Lane.
Yeah, that's right. But was your name always Lisa Lane? It's a great name.
Thank you.
It's a show name, Lisa Lane, and you're a patient care advisor at JN Nursing Registry. Tell us a little bit about the history of your company. The office has been open for 10 years. Joyce Steward is the owner. She herself had actually a grandmother that she was taking care of in her home. And, she had Alzheimer's and she was legally blind, which that's so much, and of course Joyce had her life too. And I think she had other family members that helped her, but she's seen in doing that, there's got to be a better way, and have help to come in there. So that is why Joyce created this company. And she has done a wonderful job. She's done it all on her own. She's such a hard worker. She's there till midnight sometimes. She's so hands-on. She's actually the administrator in the office, which I typically don't see that. And, she's there all the time, 24/7 available. She's just great. So if someone calls 561-330-6530, I know your office is in Delray Beach. What if they're in Broward County? Can you help them?
Absolutely. We service all of Broward and Palm Beach County. We actually have an office in Deerfield. The corporate office is in Delray. But that number, if they call that number, it will automatically roll to, the cell phone if it's after hours. So there's always somebody to answer that call. And if it's at the middle of the night, we'll get up and we'll try to staff that case and provide those services if need be.
Yeah, it's very important because a lot of people, they didn't think that they needed someone like you, and all of a sudden you're going to get a call at 7 at night. Can you get someone over here right away, right?
Yeah. Or sometimes you have people that have decided to go out on their own and do it privately, which I don't think they should do that, but they're like, oh, my private girl just left, so there's nobody, they're not working with an agency that can say, well, here's their replacement. So we'll jump in and we'll cover that case.
I think a good thing to ask, because people want to know that, is tell us a little bit about your caregivers. Give us an instance of a couple of people.
Our caregivers, all of our caregivers, they all go through an FBI background screening. They're electronically fingerprinted. We make sure that they're, have all their certificates, that they're all, updated with their CEUs. The girls, they do a great job. They go above and beyond. They'll do anything for their clients. We have a wonderful, wonderful staff. We have, a huge group of girls to choose from. We work with many nursing schools, so they help us, pick the best. And our girls are just fantastic. They really are. They do a great job.
So give us like a run. So some people only need a companion. Let's say someone just needs to be able to be driven to the grocery store. They need to have someone do light housekeeping. All right. And then up to what?
Okay, so a companion would be typically somebody that wouldn't necessarily be touching a patient. They would be somebody that is, like you said, taking them to an appointment, maybe coming in doing a little light housework or something like that. Then you go to your home health aide / CNA, okay? And they're hands-on. They're going to assist with, bathing, dressing, transfers, and, of course, do all the things that a companion can do. Then you've got your nursing. We have RNs and LPNs. An RN obviously can do any, skilled care that they would need.
Diabetic shots.
Sure, yeah. Med management, those types of services. If they had a wound and they needed wound care, we could go out and do that. That's what they would typically come in and do.
Yeah, well, that's great. So you're able to, it's just you have to find out what someone needs. Sometimes they don't think they need anything, and then you get there, you say, "Oh my gosh,
right? Yeah,
you haven't done this, you haven't done that, you haven't had a shower in a week."
Yeah, or if they need, we'll go in and we'll do an assessment, and they may need Medicare. We work with Medicare agencies. We refer them to that. They might need DME. They might need a walker or a wheelchair. We work with a DME company. So we'll help them obtain that. So, we work with everybody in the community. So we make sure that whatever their needs are, even if we don't provide it, we'll send them in the right direction to get whatever they need.
Okay, so J&N Nursing Registry is an organization that doesn't just send people in necessarily, but you kind of assess what they may need. Let's say you get in there and it's not anything that they called you for. I mean, it's something else, maybe in addition to. Maybe
right.
And you have to, I guess, have a big network of people whom you know.
Absolutely.
Because some of them maybe don't even have a doctor.
No, they don't. And that's actually a requirement. We need, to be in contact with their primary physician and work with them. As me, I'm out there in the field all day, so I do a lot of the networking, as Joyce has huge connections, so we make sure when we go in there and do that assessment, if they need something, we're going to make sure they have it. Even if we go in and it's like they don't need our services, but this is what they really needed, we're going to never turn anybody away and make sure that they have that information that they need. So that they can get the services that they desire.
Sounds like you're a company with a heart.
We are. You have to be. You have to be. Yeah.
How long have you been doing this?
I myself have been doing it for about 25 years.
20?
Yeah.
25 years? You came out of high school?
No. I started in my 20s, and I've been doing it. I've been typically, as an administrator and did a lot of internal marketing, but now I've kind of went out full force into the field. So I've been doing it forever. I love it. I have a passion for it. I wouldn't work for a company that didn't have that passion that I have. And they definitely have that there.
I bet that you loved your grandma and grandpa. I could just tell you.
Well, I did. Actually, my grandparents were in Germany, so I didn't get to see them. But, and I took care of my mom. My mom was sick. And I had to take care of her. She was in an assisted living. I moved her out of there and I moved her in with me.
Yes.
Yeah.
That was
all the way
great.
from Chicago to here. So
now that was, and did she live okay that way?
Yes, she did. She loved it here. Yeah, she did. And she was, ill. She had cancer, And, so it's like, and she loved it. She's around her grandkids. I had pets. She had pets. Could use my pets, so it was great.
Yeah, it sounds like this is really, it's not, when I say it's a fun job for you, it means that you love it, but it's hard work, and we all know that.
Of
course. I just wanted to show some of the things, and it's really important that people, if they have insurance, it really helps a lot.
Yes.
And I have insurance, and I've had it. It's I actually have long-term health care insurance.
Right.
But some people just have home care.
Right.
And some people don't. So I did notice, if I'm not mistaken, that you don't have a particular time. I mean, does someone have to have 4 hours from you twice a week? What do they have to have?
Typically, we have a 4-hour minimum.
Once a week? Or
yeah. Just because it's, you're sending out someone to make it worth their time to go. But we have sent people out for less than that. And like Joyce is so compassionate. So she'll work with anybody. So I know I recently just gave her someone of a poor woman that was in a hotel. And we sent someone out, for 2 hours, every day to go see her. And, Joyce staffed it. That's just how she is.
That's a good point. I have never discussed that with anyone before. We do have visitors here.
Yes.
And I'll bet some of the visitors might be staying in a hotel and they don't know who to call. Maybe they slipped and fell, but they, they wind up
That's
in
exactly
a hotel.
what happened to this person.
Really?
Yeah. 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 And she needed help, so, and she was far away from home, so we were right out there right away.
That is so nice.
Yeah.
See that? Well, that does say, what's Joyce's last name?
Stewart.
Hi, Joyce Steward. Thank you for sending Lisa here, and we hope that we get to meet you too, because it's a very important organization.
It
and
is.
I know there are a lot of home health care agencies around, but the real important thing is to find someone who find a quality home health care.
Right.
Very important. And unfortunately, a lot of elder people, when someone comes in, they don't really know the difference.
Right.
They don't know the difference of when you come in at first. And so it's good also to have an advocate with that older adult.
Right.
To make sure that, you have someone that you can call if you have problems. Because I know when you go in, many times they're not taking their medication correctly. What do you find some of the times?
I found all kinds of things, hiding medication, it's a mess in there. So it's, we're going to go in there and make sure that they're taking their meds, that they're organized, that
not all the sacks of papers all over the table.
Yeah, right. And then, or that they're, that they need their bath. We run into that a lot, and you feel so much better. And then we put on their clothes and we'll put jewelry on them and make them feel good. Sometimes the aides will bring them up to the office all dressed up, and they love that, So, yeah, we walk in there and, sometimes the situations aren't good. There's no food. There's old food in the refrigerator. They need, their proper food group in there. So the aide will prepare food, go grocery shopping, the medication, their laundry, clean their bedding, just everything that we normally do, and they can't do it anymore. So it's neglected. So you'll go in there and you'll see that, and then you'll see them come in with the aide, and you'll see a completely different person. And that's the best part of the job.
I'm sure. So JN Nursing Registry, we want to thank you. You've become one of our celebrity sponsors for the Boomer Expo coming up on July the 26th.
Can't wait.
It's going to be terrific. We're glad you're doing that. We like to have very high-quality exhibitors, but our sponsors are really special to us, and we do thank you so much for doing that. I think you'll find lots and lots of people there, and I'm glad that you're on the radio, and we look forward to a lot of talk with you. I wanted to ask you something. Do you also help with hospice? So when hospice comes in... typically with that role, if they come in, sometimes they come in and then they pull out. Right. They come in and go out. Exactly.
So, we'll be in there supplementing that. So that's typically how we would work with hospice. So if they're in there, they might come in for a few days and then they'll pull out and then we'll go in. So we kind of work back and forth with them. Or they could be in there with just a nurse and we're going to be in there, full-time during the day with a home health aide.
That's what I was just going to say. A lot of people, Lisa, they don't understand what Medicare pays for, and they don't understand what the thing, or even hospice. And it's fine to have someone for an hour or two. That's great. But what do you do for the other 22 hours?
Right.
And so people have to understand that when someone's very sick in bed, they can't get up to get their water, a drink of water, go to the bathroom. No. They need someone there all the time. And if you do it right, if you hire a company like JN Nursing Registry, you will recuperate quicker if it's a recuperative illness. Some illnesses aren't, as we know, and it's going to be for a long time. But many people we find have gone from rehab and now they come home.
Right.
And they need a respite when they come home because they've been taught how to sit down and how to do all that, but not easy.
Right. I always tell, everybody at the rehab, once I market them, I'm like, if we can encourage that 24 hours when they first get home, you can always cut back. So have it there and then, determine like, okay, after 3 days, maybe I only need 8 hours, so it's not set in stone our hours, we can cut back, we can increase. So we're very flexible like that.
When my mother lived to be 94, and I did have someone who was living in, and I'm curious, do you have live-in people also?
Yes, we do. Absolutely. We have home health aides that will live there. They obviously have to have, a room for them and, the proper accommodations.
And they have to have a break.
Exactly. Yeah, they do. They're allowed a couple-hour break. And if they want time off, we'll send in, someone to relieve them, so that they're not, working too much. But that person has to be a candidate for a live-in, meaning that they're not up all night, where the girl's not getting enough rest. They have to have their 8 hours sleep. So sometimes, a lot of people want to push for that live-in. If we can do it, we'll do it. But they have to be a candidate for that, meaning we don't want to have anybody taking care of our family member that's overly tired. They're not going to do a good job then. We're not providing proper service then.
Right. Let's make sure everyone gets your phone number. Get your pencils out. 561-330-6530. 561-330-6530. And I know that do you have a website? I'd see that now.
Yeah.
jnnursing.com.
Yep.
jnnursing.com.
And there's actually, there's if they click in there, they'll see there's a spot where they can go ahead and just put their name and everything in there, and it'll go right over to our office.
And so someone will respond to you.
Absolutely.
Let's go back, though, to what we were talking at the very beginning. When someone calls you, they're going to have a little problem with what they're describing that they need. So do you have, who answers the phone? I guess that's my first question, because that's always so important. Who answers the phone?
Usually, typically, we all pitch in answering the phone. I'm out in the field, so I typically don't. But if, it'll be transferred over to probably Joyce. She's our administrator, and takes most of the intakes. So she would.
That's great.
I know. That's what I said. She's so hands-on. You don't see that.
The heart of your business.
Yeah,
the person
you
who
don't
calls
see
in.
that.
No,
Most of them aren't the administrators.
No, or the founder.
No. Yeah. So, she'll do the intake, and then, if she's talking to the client, and they are confused, obviously we're going to send out our registered nurse who's going to go out and do an assessment. We'll try to get a family member's phone number, a daughter or son, to contact them if we feels like, the client's unsure. We also work with the doctor. So, sometimes if the doctor, calls it in, he'll say, this is what she needs. So we try to always work with like a family member if that patient seems a little bit confused. But we do send our registered nurse out who's going to go out and do a free assessment for them.
All right. And so you're saying that people with cognitive problems or Alzheimer's, you will take those kind of
Absolutely,
patients?
Yes. And we make sure that any caregiver that we put in there has experience with that. Not just the certificate, but actual experience. Because it is a different type of person to take care of, and typically someone like that would probably eventually need around-the-clock care. Somebody there that's awake all the time, so they'd have a couple different shifts coming in.
Yeah, and the training is so important.
It is,
and I think you're saying that
they are. Most of them are, certified with their all. They have to have that with their CEUs for their certificate. But we want somebody that has experience with that. That's actually worked with an Alzheimer's patient.
And so this has sounds like a life work for you.
It has.
I mean, you love
love it.
I know, I can hear that.
Okay.
And can you talk about some patients who you have helped, and all of a sudden what you went in for, and then what happened, and now they're happy, and they're referring patients to you?
Yeah. Like I said, we had the lady that called that was, at the
hotel.
At the hotel, and she was so frantic, and I felt so bad for her. And, I stayed on the phone with her.
What did she need?
She actually was at a hotel, and I'm not going to mention the hotel.
No, of course not.
But it was supposed to be equipped for someone with a handicap. And she fell. It wasn't properly equipped. And so, she literally could not go to the bathroom until we got there. And I kind of got on the phone with the hotel and then, their attorney and worked things out to get somebody over there right away. Whatever we have to do to, help someone out, because she was frantic, So I was on the phone with her, on and off for most of the day, making sure that we got somebody out there for her. I've worked with patients, that have been with during the storms and stuff, and they're scared. They didn't want help, which we try to encourage everybody to do that. And so you're on the phone with them, because we have the phone 24/7, because they just want someone to sit on the phone with them. So it's whatever they need. We'll try to do it. And I would never just be like, well, I'm sorry, I can't provide that service for you, and send someone away. So I think that's the best part of the job for me is, being like, oh, no, I'm going to make sure something is done for this lady, and we're going to get it done. And if you've got a great team backing you up, it's totally possible.
Great words. This says so much about your company. That's why we have radio shows like this, because ads are great, but they don't have radio coming out.
No, they don't.
And this is,
no.
And you're great. So the phone number to call for JN Nursing Registry, Inc. is 561-330-6530. Again, that's 561-330-6530. Their headquarters is located in Delray Beach, but if you just call that number, they're going to send someone out. If you're a male patient and you want a male nurse or helper, I'm sure that they have that.
Absolutely.
And remember that they are available 24 hours a day, 7 days a week. And if you, hopefully, all our listeners are going to be going to our Boomer Expo over there at Coconut Creek Seminole, Coconut Creek Casino, and you're going to see the people from JN Nursing Registry as one of our major sponsors, and I'm sure you're going to be giving away little goodies or something.
All kinds of goodies. We have great goodies with the best booth.
Oh, my gosh. Okay, well, I'm looking forward to that also. And you want to make sure that when you are going to go to a nursing care, someone who really needs help, just like Lisa Ann has been describing, that you better check them out. You better make sure, as Lisa Ann said, that they check out all the people that come to you. Don't take a referral from someone they met on the street.
No.
Let's not do that. Let's go to a
thing.
really good company, and we are so happy that you were here, and you were great, and we'll talk to you again another time.
Thank you so much.